Public health experts on Wednesday criticized the United States for securing a large supply of the only drug licensed so far to treat COVID-19. The U.S. government announces this week that it had an agreement with Gilead Sciences to make a bulk of their production of remdesivir for the next 3 months available to Americans. The Department of Health and Human Services said it had secured 500,000 treatments through September, which amounts to all but 10% of production in August and September. To the extent possible, we want to ensure that any American patient who needs remdesivir can get it, Health and Human Services Secretary Alex Azar said in a statement. Until now, Gilead had donated a drug that ended Tuesday, and Gilead this week set a price for new shipments at $2,300 to $3,100 per treatment course. The company is allowing generic makers to supply the drug at much lower prices to 127 poor or middle-income countries. In a statement Wednesday, the California-based Gilead said its agreement with the United States allows for any unneeded supplies to be sent to other countries. The company said it is working as quickly as possible to enable access worldwide, but it noted that the United States is seeing a significant rise in COVID-19 cases, while most EU and other developed countries have reduced their levels of disease considerably. Early studies testing remdesivir in patients hospitalized with COVID-19 found that those who received the treatment recovered quicker than those who didn't. It is the only drug licensed by both the US and the European Union as a treatment for those with severe illness from the coronavirus. Dr. Peter Harvey, who is running a large study testing several treatments for COVID-19, told the BBC that a stronger framework was needed to ensure fair prices and access to the key medicines for people and nations around the world. He said that as an American company, Gilead was likely under certain political pressure locally. British Prime Minister Boris Johnson's spokesperson, James Lack, declined to criticize the United States for the move. He said the UK had a sufficient stock of remdesivir for patients who need it, but didn't specify how much that was. Thomas Enderovich, head of the Danish Medicines Agency, told Danish broadcaster DR that the move could endanger Europeans and others down the road. Dr. Michael Ryan, the emergencies chief of the World Health Organization, said the agency was looking into the implications of the US deal for remdesivir. There are many people around the world who are very sick, and we want to ensure that everybody has access to the necessary life-saving interventions. He said WHO was fully committed to working toward equitable access for such treatments. Gilead had been developing remdesivir for years as a viral treatment with millions in US funding before it was tried for coronavirus. The consumer group Public Citizen estimates that at least $70 million in US public funding went to develop remdesivir. On Wednesday, Gilead said its supply of remdesivir should increase by the end of September and meet global demands after that. It said some countries should have enough for current needs from the supply they receive for patients testing and other programs. Gilead has said it expects to spend more than $1 billion by year's end on testing and manufacturing of remdesivir. Dr. Penny Ward of King's College London noted that many countries have legal provisions that allow them to prohibit the exportation of drugs to other countries during emergency. Ward pointed out that another drug that may help people with severe COVID-19, the cheap steroid dexamethasone, is long off patent and available globally. The US has the worst coronavirus outbreak in the world, with 2.6 million reported infected and 127,000 confirmed virus-related deaths, according to the tally of Johns Hopkins University. To date, COVID-19 has sickened more than 10.5 million people worldwide, killing around 512,000, according to Johns Hopkins. Numerous countries, including Britain, France, Germany, Netherlands, and the United States, have struck deal with drug makers to have millions of doses of experimental vaccines delivered before they are licensed. British politicians have said if the vaccine currently being developed by Oxford University and manufactured by AstraZeneca is proven to work, Britons will be first in line to get it.